Just imagine for a second. You're looking in the mirror, maybe putting on a tie or a necklace, and you feel it. A small, totally unexpected lump. It's a moment that would send anyone's mind racing, right? But is this as rare as it sounds? Well, you might be really surprised by this. Believe it or not, by the time we hit age 60, about half of us have a thyroid nodule. Yeah, half. These little growths are incredibly common, and honestly, they're usually found completely by accident during a routine checkup. Now, before you start checking your neck, here is the most important number of all. Over 90% of these nodules are completely harmless, totally benign. That's a huge relief, of course, but it also creates this massive diagnostic puzzle. And that really is the million-dollar question. With so many benign nodules out there, the real challenge is figuring out how to find that tiny fraction that are actually cancerous, without putting millions of people through invasive procedures they just don't need. All right, so to understand the solution, we first have to get a handle on the problem itself. So let's start with the basics of this very, very common lump. Okay, so your thyroid. It's this small, butterfly-shaped gland located right here at the front of your neck. Its main gig is to pump out hormones that regulate your metabolism, how your body uses energy. It's a tiny little gland with a really big job. So a thyroid nodule is, simply put, just an abnormal growth of cells that forms a lump inside that gland. And here's the thing. Most of the time, these nodules don't cause any symptoms at all. You wouldn't feel any different, and your hormone levels are usually perfectly normal, even if it turns out to be cancer. For decades, the standard way to check out a suspicious nodule has been a procedure called a fine needle biopsy. This is how doctors have been getting a closer look to see what those cells are really up to. The process is often called an FNA, and it's pretty straightforward. First, they use an ultrasound to get a perfect picture of where the nodule is. Then, using that image as a map, a very, very thin needle is guided in to grab a tiny sample of cells. The whole thing is usually over in less than 30 minutes. Now, a lot of the time, the results from these biopsies are crystal clear. As you can see, about 80% come back as benign, which is fantastic news. Another 5% are clearly cancerous, which gives a direct path for treatment. But here's the catch. For up to 1 in every 5 patients, the result is, well, it's uncertain. And this gets us to the heart of the problem, this diagnostic gray zone. It's when the pathologist looks at the cells under a microscope and just can't say for sure if they're benign or malignant. The answer they have to give is just maybe. And this isn't some small, rare issue. As researchers in the field confirm, this indeterminate result is the #1 challenge. It puts everyone, doctors and patients, in a really tough spot, trying to make a huge decision with incomplete information. For many, many years, the standard approach was just to play it safe. The recommendation was often to go ahead with diagnostic surgery, usually taking out half of the thyroid gland, just to get a final, definitive answer. But here's the crucial, staggering statistic. After doing all those surgeries, the final report showed that about 3/4 of those maybe nodules were actually benign all along. That meant a lot of people went through surgery with all the costs and risks for something that was never a threat. This is where the story takes a really fascinating turn. To solve this problem of the gray zone, scientists went from looking at cells under a microscope to actually decoding the genes inside those cells. This is the era of molecular testing. And this just perfectly shows the shift. The old way often led from uncertainty straight to an operating room. But the new path, it slips in this absolutely crucial step, a molecular test that analyzes the nodule's genes. This allows for a much smarter decision and lets people avoid surgery if they don't really need it. So what exactly are these tests doing? You can kind of think of them as genetic detectives. They look at the DNA and RNA inside the cells from that original biopsy, and they search for specific patterns or fingerprints. These genetic signatures can tell us if the cells are acting like a normal, benign growth, or if they have the telltale signs of cancer. Of course, for a test to be useful, it has to be incredibly accurate. And a great test really does 2 things exceptionally well. First, it has to be amazing at finding cancer when it's actually there, so you don't get a dangerous false negative. Second, it has to be just as amazing at confirming when cancer is not there, so you don't get a false positive and go through treatment you don't need. The goal is to get it right every time. All this research has led to several really advanced molecular tests. You've got names like Afirma, ThyroSeq, and others. And while they use different, complex methods to look at a nodule's genes, they all share the exact same goal: to replace that uncertain maybe with a clear, confident assessment of cancer risk. But this technology does way more than just slap a benign or suspicious label on something. For the nodules that do turn out to be cancerous, the genetic information can actually provide a detailed roadmap for treatment. And this, right here, is the cutting edge of personalized medicine. By finding a specific genetic marker, say a BRAF mutation or a RED fusion, doctors can pick a drug that's specifically designed to attack that exact molecular driver of the cancer. We're moving away from a one-size-fits-all approach to something highly targeted and individual. And this all points to a really profound shift in how we think about and treat cancer. Not just thyroid cancer, but all cancers. We're moving into a future that's both personalized and hopefully much more proactive. So here's the big takeaway. The journey that starts with finding a common lump in the neck is actually at the forefront of a medical revolution. We're shifting from making life-changing decisions based on how a cell looks to making them based on its fundamental genetic instructions. And this leaves us with a pretty powerful thought. I mean, if we can decode a tumor's genes to figure out the best way to treat it, what's next? Could we one day use this same incredible science to analyze our own genetic blueprint to predict and maybe even prevent cancer long before a lump ever even has a chance to form? The journey is just beginning.